Everyone always asks, how long should you be an RN before applying to nurse practitioner school? So let's talk about my nursing journey as an RN and when exactly did I apply for nurse practitioner school. So I graduated from the illustrious Howard University in 2019. HU, you know. It was there at Howard when I completed a 4-year BSN to RN program straight out of high school. I graduated in May 2019 and I took my NCLEX late August 2019. I studied the entire summer for that test, and let me just say, I know people have their opinions about NCLEX and saying that it wasn't that bad, but for little old me, yeah, that test was the hardest exam that I ever took in my life. It was so nauseating. I vomited after, and the waiting game of knowing your results, oh my God, the anxiety. I'm not a good standardized test taker though. I didn't do well on my SATs. I even tried the ACT, like it just wasn't working. That wasn't like a reflection of how intelligent I was. But anyway, your girl passed NCLEX on the first try. Don't ask me how. Like I said, that was the worst exam I ever took in my life. So then comes a job search after you pass NCLEX, right? I lived with my mom post-grad in Philly, and so I tried applying for all the major hospitals, CHOP, Einstein, Temple University Hospital, any hospitals you can think of. I applied for all the hospitals and I wasn't getting not a call back, straight decline. They was not looking for no new grad nurse. We know like that's part of the struggle. Being a new grad nurse is not for the weak. Trying to find a job and people saying they want experience. How can I get experience if you don't give me a chance? That whole type of site is vicious. At this point, like I said, past NCLEX in late August, end of the summer is here. September comes, now we're approaching October. I'm like applying everywhere. Like your girl been sitting here for months and I'm just not getting no type of luck. When I was in my undergraduate nursing program, though, a couple of my interests was psych, mental health, and labor and delivery. I don't know about you guys, but my professors was highly discouraging going into any field besides med surg straight out of school. You're going to lose your skills if you go into psych. You need to get your skills in med surg. Med surg is the place to be. And trust, in my clinicals, I really fucking hated med surg. I had constant migraines doing it. Like, I knew it wasn't for me. And anyway, none of these hospitals or facilities that I was applying to in Philly or the surrounding counties was accepting your girl as a new grad. I guess who did give your girl a call back for interview? Like 3 psych facilities, y'all. Y'all know psych was a good passionate interest of mine as an undergrad. So boom, I locked in with one of the psych facilities that I interviewed with. It's a residential facility. I was really working with child adolescent behavioral. And y'all, don't listen to them people who say you gotta go into med surg straight out of school. Like, no, you don't. There's so many opportunities out here that you can utilize and practice your skill. This psych residential facility I was working at has wound care, GJ tube feeds, ostomy care, diabetic care, wound care, you name it. And it's across the lifespan. We have child, adolescents, we have older adults as well. And trust me, your girl was getting her skills in. Individuals with psych or mental health disorders may have medical complexities as well. So anyway, life is great. I'm working at this psych residential facility for about 3 years, and then I decide I want to go back to school for my nurse practitioner. At this point, I become a full-time psych charge nurse at this facility, and I'm working as a charge nurse and going to school full-time. My psych nurse practitioner program was about 2 years, and like I said, I'm working as a full-time psych charge nurse at this time. My life was miserable. Work was miserable. I hated being a charge nurse. I never in life want to be somebody's charge nurse, especially at a residential facility. I hated it. School wasn't too bad, but like the work aspect on top of school, I was so miserable. But I didn't give up. I pushed through. I completed my program, and now I am a psychiatric nurse practitioner at the residential facility that I was already working at. To answer the question, how much RN or nursing experience should you have before applying for nurse practitioner school? I recommend at least 3 to 5 years. I was a psych nurse for 5 years. Applied to nurse practitioner school at the 3-year mark, and I worked and went to school at the same time for the remaining 2 years. I also recommend, if you are going into a specialty such as psych, such as women's health, such as dermatology, I recommend that you get some type of experience as an RN in those type of settings, and you need at least 2 to 3 years of experience in said specialty. For instance, a lot of you guys ask me, do you need psych RN experience before you apply for a psych nurse practitioner? Absolutely. And it needs to be substantial experience, not just a year, not 6 months. How can you be prescribing medication for someone or managing the care for someone if you don't know the nursing skills behind it, the nursing rationales, the techniques, the de-escalation techniques, therapeutic communication? These are all skills that you get exposed to in your RN experience and are highly, highly useful in your practice as a nurse practitioner. Again, that is essentially my nursing journey and path to psych nurse practitioner, PMHNP. I'm Psych NP Nera. Make sure you give me a follow. If you guys have any more questions or comments, feel free to reach out.